Dr. Bernard Okoboy began his 5-day tour of the Upper West region at the Upper West Regional Coordinating Council, where he met with the Upper West Regional Minister, Dr. Hafiz bin Sali. He recalled with nostalgia his last visit to the region as a Deputy Minister for Health when the region was confronted with fighting the global pandemic of the coronavirus alongside cerebrospinal meningitis (CSM). 4 to 4 persons had lost their lives as a result of CSM at the time, and urgent steps were needed to put a lid on it. Dr. Okoboy is now the Chief Executive Officer of the National Insurance Authority and is back in the region, and this time to visit and interact with stakeholders and officials of the NHIA.
Before we took over administration some 7 years ago, we had serious liabilities when it comes to arrears. This also affected what happened in the hospitals. People go to the hospital, they will tell you, instead of 4 medicines that you have to take, we have 1. People go to the hospitals, they will tell you, we've not been paid. Sometimes they take money from clients. Today, as we speak, the good news is that from January to now, we've paid over 1 billion Ghana cedis to clear almost all the arrears that we have with hospitals.
He also used the opportunity to announce some new additions to the benefit package of the health insurance scheme.
We've also added hydroxyurea, a very recently developed drug, very effective at reducing crisis occurrence in sickle cell patients and improving the quality of their lives. And then thirdly, we all know that Herceptin, a wonderful drug, is a wonderful drug which improves the chances of survival for breast cancer women. We have not stopped there. Recently, some few weeks ago, Nana Addo Dankwa Akufo-Addo, His Excellency, announced that mental disorders or diseases will now be put on the benefits package of the National Health Insurance Scheme, so that people with depression, schizophrenia, all kinds of mental diseases that end up with people walking on the streets, we now can treat them and pay for them, so that people can be brought back to society.
Upper West Regional Minister Dr. Hafiz bin Sali, on his part, appealed to Dr. Okoboy to work to ensure that all 11 municipals and districts in the region have independent officers to improve healthcare delivery in the region.
Your agency is operating in 9 out of the 11 areas we have in the Upper West region. Lambuse is still hooked to Jirapa, while the Piema Buse is also hooked to Nadoli.
Reporting for Joy News, Rafik Salam. Wow.